The Essix Appliance is another temporary removable prosthesis. We will look at the construction of one of these appliances. Here are several options for the replacement of missing teeth that you can use. One is an interim removable partial denture. When you take out teeth, you can place one immediately or at a later time. Two, an Essix appliance, which is what we're going to talk about, which is very helpful for the immediate replacement of teeth. Three, you can affix an extracted tooth or a denture tooth in an area where a tooth is extracted by placing composite resin to lute it into position. And four, if you're going to be doing a bridge in that area, you can prepare the teeth on either side of the tooth to be extracted, extract the tooth, and create a temporary fixed partial denture for the patient. What exactly is the Essix Appliance? It is a means of a temporary replacement for missing teeth. It's a really quick way of providing aesthetics when a tooth has been lost or is going to be extracted that day in your office. It can be constructed in the office and the patient leaves with something in the area where the tooth has been extracted. It can also be used for minor tooth movement, and it can be used for soft tissue management at an implant site. The code for this at the U of L, we sometimes use 8680A, or we also use a removable partial denture that is a temporary RPD code for the Essix Appliance. It can be found under either the removable or the orthodontic section in Axiom. Here are some of the things that you'll use when you're doing this Essix Appliance. You can use the Triad gel that is light cured for blocking out undercuts. The Triad machine will be available. You'll need the Vacuform machine and the Essix plastic sheets that are available from the South Dispensary. They are about 040 as far as thickness. The sheets are shown on the bottom left. You'll need some type of replacement tooth. Now that can be a spare denture tooth. We have a box of spare denture teeth in the back of the South Lab. Also, if you don't, you can order them with a tooth order form. You can use the natural tooth that's been extracted, or in the picture on the lower right side, those are two crowns that came off the patient, and they're going to be placed in the Essix Appliance, which will match the other teeth very well. The first thing that you want to do is make a diagnosis. This is a patient that needs a replacement for 3 missing anterior teeth while healing takes place for implants in the area. The options are an RPD, that is a temporary RPD, and an Essix Appliance. The advantage of the Essix for this particular situation is that no pressure will be exerted on the implants during initial integration. The question mark is whether that Essix is going to be a very temporary prosthesis, and it is more apt to break under long-term wear than will the interim removable partial denture. Also, the longer the span, the more risky the Essix Appliance is for a restoration. The next thing that you have to determine is, does this case have to be mounted to construct an Essix or an interim removable partial denture? Usually, multiple tooth replacement requires mounting the case to determine the arch form and the occlusion of the opposing arch. If it opposes multiple artificial or natural dentition, the casts have to be mounted in order to set the teeth. Casts of both the maxillary and the mandibular arch are therefore necessary when taking impressions. Here's another case needing temporary tooth replacement. This can also be aided by an Essix Appliance, but long-term replacement will require a removable partial denture or implants in that area. These are the canines that she has sheared off at the gingival level. The prognosis of restoring them with endo, cast post, and crowns is questionable. You must analyze her occlusion and figure out what the parafunctional activity or what's happening that actually caused this activity to occur. The next thing you're going to want to do is select a color for the tooth replacement. We are going to be using the True Bite Biotone Classic mold board teeth and the Classic Shade Guide. Each mold board has its own separate shade guide. In the back, usually there's a box of unused teeth that you can actually see after you collect the color that you need. Take it back, the tab back, and see if you can match a size and a shape of a tooth in that spare box before actually ordering teeth. The classic teeth are used because we don't charge that much for our Essix appliances or our temporary RPDs. And if we used the teeth that we use in the clinic for our permanent prostheses, we would lose a lot of money on the case. 1x6 of, for instance, the classic teeth might run around $8, whereas a 1x6 of the portrait teeth that are used on the permanent prostheses would run around $65 for a 1x6. That means from canine to canine. So we only charge about $100 for our Essix appliances, so we need to conserve on some of the cost of materials. We might also use the crowns that came off on that one patient that I showed you. You could actually use the tooth that's extracted, cut it off, and make some preps in it with some class 3 types of preps and elute it to the teeth on either side, or use it in your Essix appliance. Or you might use just a denture tooth that you order. A tooth order form has to be filled out if you use a denture tooth. This is an example of the tooth order form that has to be filled out in order to order teeth. Again, you'd like to use the scrap teeth or the spare teeth that have not been used that are put in a box if you can, but if you can't, then you have to fill out one of these forms and order the teeth from the South Lab dispensary. The success of the Essix appliance is dependent upon the accuracy of the impression. You have two options available. First of all, you can take an alginate impression because if it's accurately recorded and poured immediately, the impression is very accurate. The second choice is the polyvinyl siloxane or polyether impression. And again, if accurately recorded, it's going to be a great impression. It is much more expensive to use the polyvinyl siloxane or the polyether versus the alginate. The advantage of the polyether, though, or the polyvinyl siloxane, is that you could, if you wanted to, mail those impressions to your laboratory if you want someone else to construct this prosthesis. So 2 impressions are necessary in this particular case, the maxillary and the mandibular. And at the same time, you're going to have some type of a jaw registration record. And again, we can use a polyvinyl siloxane. We have Regisil at the window, but some type of a bite registration paste to record the mounting is okay in this particular case if you have a good tripod arrangement where 3 teeth in a triangular form are touching to support both of the cast. If the cast can't be supported, then you're going to have another appointment because you will require the aid of record bases in order to be able to mount the case accurately. Here's a case mounted on a hinge articulator. I would suggest that you index the cast to be used for the Essix retainer. When mounting it, place V-shaped indexes that do not have any undercuts in them in the cast, and this will allow easy removal from the mounting apparatus after the teeth are set and you're ready to position the cast on the Vacuform machine. Apply Vaseline in the indexes before you mount the case in a small dime-sized spot in the middle of the back of the cast. Then mount the case. The case really, in this case, needed to probably be mounted with occlusion rims rather than just a bite registration. The first step in the procedure to make an Essix is to block out any undercuts and deepen braziers that are in the interproximal areas. It's important also to block out the distal to the most posterior teeth in your planned retainer. For blockout of the undercuts or deep embrasures, you may use any of the following materials. You can use base plate wax, you can use some Siltec putty or even Silly putty, and you can use Triad blockout resin. If you use the Triad blockout resin, then you're going to have a light curing unit to cure the material. If you use the blockout resin from the Triad kit, then it will have to be cured a couple of minutes. If you use the putty, give it a little bit of time to set. You need to prepare your teeth before you place them in the Essex. They need to have some kind of mechanical retention to help retain in the Essex material. For denture teeth or old crowns, I'm going to place some kind of a retentive slot in them using my 557 burr. That slot has to be wide enough for the material to kind of mechanically lock in place. After the Essex is made, I sometimes will use some acrylic resin or even some super glue in the area to help retain the teeth. The next thing that I do is go ahead and set the teeth. If you have multiple teeth, you will need to have your cast mounted, of course, for this setup. You can use sticky wax, or sometimes I like to use a slight amount of super glue to help hold and align the teeth. If you use sticky wax, you don't want to get it into the retentive area that you have prepared. You want that Vacuform material to get into that area to help retain the teeth. Try to keep the sticky wax just on the cervical portion of the teeth. A little bit of super glue goes a long way. You don't want to use very much of it if you're going to use super glue. Some consideration should be given to the length of the edentulous span for the Essix appliance. This one shown on the upper right is a very long span and is very apt to fracture. If an Essex interim method is used, it should be told to the patient that it's a very temporary fix. A better interim prosthesis for this would probably be the temporary removable partial denture. The Essix appliance, though, does help to prevent excessive pressure on newly placed implants, and it can be useful in this type of a surgical procedure. Again, even if you get a short time out of it, it may be long enough to get those implants to be more stable and increase the possibility of integration of the implants. This shows the crowns that were fractured off, and they were set on the patient's arch with a little bit of sticky wax or with some super glue at the cervical for the Essix appliance. You can attempt to place Vacuform material over the teeth set in wax, but if you have multiple teeth and the teeth are set with the wax, they may move during the Vacuform procedure because of the heat and the pressure of the material. So, in that case, you may choose to make an impression of your cast with the set teeth, then pour the cast, and then make your Vacuform on that particular cast, and then place the teeth in it after the Vacuform material's already been formed. This will prevent any movement of a large amount of teeth that have been set. After you remove the cast from the mounting, it's a really good idea to trim the cast so that it's very thin and remove the palatal section from the cast. The Vacuform machine will pull the material down over the cast more effectively, and the material will be adapted to the teeth much better if that vacuum power is increased by having a cast that is thinner so that the air can go through it. It's also better to work with a dry cast, because if you have a real wet cast, you may have trouble with good adaptation of the plastic over the teeth. You're going to pick up a piece of 040 Essix Appliance material from the South Dispensary. Load it into the upper portion of the vacuum machine and heat it under the coils until it droops to a point sort of as shown in the picture to the right. Activate the vacuum with the button and then pull the material down over the cast as shown in the picture on the next slide. Allow time for the material to be sucked down over the teeth and adapt itself really well into the embrasures. Then turn off the vacuum and turn the heat coil to your right so that it gets out of the way. The arrow shows the handles that are used to pull the Vacuform material down over the cast. After the vacuum and heat element have been turned off, release the clamp shown with the green arrow and allow the material to cool. If you try to remove it prematurely, you may distort it. You may use a separating disc now to cut through the material to release it from the cast. You want to cut at least 4 millimeters below the marginal gingiva at first. There's a really nice large cutoff disc that is available at the dispensary for cutting through that plastic. It really makes it go lickety-split. It's much faster than the little separating discs that often break while you're trying to use them. Also, a 557 or 558 burr can be used to go around the cast to cut the material off the cast. After you get the Essex off of the cast, one thing you can use is a crown and bridge scissors to trim around all of the edges and decide where you want to cut that Essix appliance off. Remember that if you cut off the Essix appliance to where it's just minimally covering 1 or 2 teeth on each side of the replacement teeth, that it's probably not as strong, and then also it will interfere with occlusion. You'll be high on the Essix appliance and not touching on the remaining teeth. So some people choose to cover all of the teeth and kind of treat it like a bite guard. Either way, it should be trimmed about 2 or 3 millimeters above the marginal gingiva. Some people will prefer having it trimmed to where it scallops out right at the cervical and does not even touch the marginal gingiva. You have 2 philosophies on this, but it'll depend on who you're working with in the clinic as to which way to do it. If you're not happy with the edges and the way they feel, then you can do some additional trimming that with the acrylic resin burr itself. But the very best thing that I've found is a wire brush that is made by the Essex company, and it is available in the dispensary in the South Lab that you can check out for polishing the edges. Little fine wires that do a beautiful job on smoothing those edges of the Essex appliance. Prior to delivery, you want to disinfect the prosthesis, and you will do that back in the laboratory. Wash the prosthesis thoroughly to remove any residue chemicals or any pumice that you may have used. The chemicals are very unpleasant tasting to the patient. This is the try-in of the Essix appliance for that case number 1, which was the construction using denture teeth and was to allow for a healing of implants underneath it. I will let you know that this did fracture after a very short time. This brings to light the rule that a long-span Essex involving multiple teeth does not last as long as a short-span appliance. Also, you must let the patient know that it may need to be replaced after a while with the removable partial denture prosthesis. You must emphasize that it is meant for aesthetics and not necessarily function. This one was used in order to keep pressure off of the ridge while implants were placed and healed. It does look very nice, looks very natural, and the patient left immediately with an appliance in their mouth after extraction and implant placement. Here's the other case that we used where we placed the patient's crowns that had fractured off in the Essex. You do need to think about occlusion when making one of these. Unless you cover all of the teeth that are in occlusion with the opposing arch, the occlusion will be high and more uncomfortable because it will only be touching in certain places where the Essix is placed. So think about this when you're deciding how much of that Essix to cut off. You do have to adjust the occlusion if that even means putting holes in it so that all of the teeth can come together when the patient is in contact. At the delivery appointment, you should do the following. 1, do an occlusal adjustment so that you get even contacts on the prosthesis, and even if you have to grind through a spot on the retainer in order to bring all of the teeth into occlusion. Then you'll give patient care instructions to the patient, and that's going to be talked about on the next slide. Also, you want to practice inserting and removing the prosthesis with the patient so that you're sure that they can get it in and out. And then make a follow-up appointment so that you can check their progress and make sure that everything is looking good, especially like the tissue around the gingiva areas. Also, give the patient some type of a container that can be used to store the prosthesis, and possibly even a brush for cleansing the prosthesis. As far as patient care instructions, you want the patient to do the following. You do not want him to incise food using this prosthesis. It's primarily designed for the patient's aesthetics. Then you want them to also brush it with a soft toothbrush and tell them that it can be soaked in a denture cleanser to freshen up the taste of the prosthesis on a daily basis if they wish. You don't want them to wear it at night while they're sleeping, and when it's not in the mouth, you want them to store it in a protective container with wet paper towel or napkin inside. That will prevent the prosthesis from drying out, and it'll also prevent pets from getting to it because dogs would love this. It kind of is like a chew stick for them, and they can put it into 1,000 pieces, as well as endangering themselves from the swallowing of sharp plastic. A small plastic sealable container is ideal. Sometimes like a margarine container is always good for that. If it should be worn during eating, you need the patient to realize that it may break on too much forces. Then tell them to not necessarily chew gum with this type of prosthesis. I've found that patients will have trouble with the gum sticking to it, and it can get all kind of nasty. Here are some sources of information about Essix appliances. If you want to read additional articles, they're listed on this page. You can contact some of them by just clicking on those yellow highlighted areas, and you'll go right to the article on Essix Appliances.